Welcome to Conversations with B'nai B'rith International. I'm CEO Dan Mariaschin, your host. Thank you so much for spending some time with us today. Today's conversation will focus on how COVID-19 is impacting older adults and the government's role in helping seniors with the pandemic. With me to discuss these issues and more is Congresswoman Grace Meng. Meng is serving her fourth term in the United States House of Representatives from New York's 6th Congressional District, which encompasses large portions of the New York City borough of Queens. Meng is the first and only Asian American member of Congress from New York State and the first female Congress member from Queens since former Vice Presidential nominee Geraldine Ferraro. She's a member of the House Appropriations Committee, which has jurisdiction over the annual funding decisions for the Older Americans Act programs, Senior Corps, and other social services. She also serves on the House Ethics Committee. In her time on Capitol Hill, Congresswoman Meng has had several pieces of legislation signed into law, and these include laws about religious freedom, measures to assist veterans, and provisions to improve consumer protections and safeguards for children. When it comes to seniors issues, Congresswoman Meng supports upholding and improving Social Security and Medicare as vital safety nets for older Americans, understanding that both help lift millions of senior citizens out of poverty. She's also taken time to visit and work with B'nai B'rith of Queens, the independent senior living facility that we oversee in her district. And in our conversation today, we'll talk about how seniors in her district, including B'nai B'rith in Queens, one of our senior housing facilities, have been impacted by COVID-19. And we'll also cover how the community is responding to the pandemic, what Meng has done to assist older Americans, and the possibility of another federal stimulus package. Congresswoman Meng, great to have you with us today.
Thank you, Dan, for having me. It's always good to be with you and so many of your members as we talk about and try to translate what Congress is doing for the people here in Queens.
Well, let's talk about how seniors are dealing with a pandemic. As everyone knows, older Americans have been particularly susceptible to the virus. And as a sponsor of Housing and Urban Development Section 202 housing for low-income seniors, B'nai B'rith is keenly aware of how the virus has impacted older Americans. And we're proud to sponsor B'nai B'rith of Queens, a Section 202 building in your district, which you have been kind enough to visit, as I mentioned. Now, in your district and around the country, what have you seen as the most urgent issues facing older Americans because of the virus?
Well, thank you for that question. And, it's really heartbreaking to see the increasing number of cases that have been showed across the country. But as you and I know, the pandemic really sort of began, the seriousness of it really started in our home county of Queens. Queens, in many ways, has been before the epicenter of this pandemic. And I remember all the way back, I believe even in mid-March, end of March, before the news stories really talked about what was going on around the country, they were talking about reports and stories that were coming out of our home county of Queens. We were getting calls from people who worked in the hospitals about how people didn't have basic masks, PPE, healthcare workers, and how hospitals didn't have enough ventilators. So we knew from day one that it was a real serious situation for us here in Queens. My district has a disproportionately high number of senior citizens to begin with. So whether it involves seniors who are living at home, seniors who are living in nursing homes, and everything in between, we wanted to make sure that we were hearing from our seniors and see how we could pass bills in Congress that would directly impact them.
Now, during the pandemic, B'nai B'rith of Queens faced food and supply shortages, actually, because of local grocery stores temporarily closing. Fortunately, community partners like Met Council and Acting Queens Borough President Sharon Lee provided pallets of food and face masks, and ultimately the local grocery store did reopen as well. New York State, in particular New York City, where your district is located, was particularly hard hit by COVID-19 in the early stages of the pandemic. And in March and April, the daily numbers of people diagnosed with the virus just skyrocketed. And as you mentioned, epicenter was the word. Now, fortunately, since May, cases in New York have dramatically decreased. What practices and policies do you think were instituted that may have helped to bring down the number of COVID-19 cases? And what are other state and local governments learning from New York, particularly in the South and the Southwest, where the cases now are skyrocketing?
Well, it's interesting that you mentioned this because as New York was going through all of this, I was trying to share stories with my colleagues from around the country. So, even basic things like make sure you try to stock up on PPE, make sure that you are providing these types of services where senior citizens could get groceries. And, even from basic government services, like how do we make sure our seniors got stimulus checks, for example? And even to talking to hospitals and making sure that they were stockpiling ventilators as much as they could. And so we do see that New York has come out of it, but New York State represents about one quarter or one fifth of the deaths nationwide of people who have succumbed to coronavirus. And so it is a pandemic that has affected so many people, so many families here in New York and throughout the country. We were proud to have secured over $50 million from legislation passed in Congress to provide help to organizations and to healthcare facilities directly right here in our district.
Well, we know that in April you called on grocery stores to allocate special delivery slots for senior citizens as well. We all recall trying to get deliveries at that time. And the message would come back, well, there is a slot, but it's 5 days from now, or it's 7 days from now. So we certainly appreciate what you did in that regard. Now, New York State has begun the reopening process. And as mentioned, there are states across the country that have reopened and later suffered from spikes in COVID-19 cases, such as Florida and Texas, but not only those two states. What are the state and city doing to limit people's exposure to the virus, in particular seniors who are by definition very vulnerable?
Well, I think that part of the reason why New York has come out of this so relatively quickly and in a strong way is because people are generally adhering to the rules of wearing masks and self quarantining as much as they can. Not everyone has the luxury of being, safely at home. But whether you're traveling on public transportation or still having to go to work or just going to your local supermarket, it's still important to wear the masks and to wear them correctly so that we are not potentially spreading it to other people. And I'm glad that the state has put in place some sort of quarantine because we are seeing these cases skyrocket in many other states around the country. And so we are not completely out of the woods yet. We still need to be careful as people potentially return to New York from some of these states as well.
Now, the Centers for Disease Control and Prevention, the CDC, and the New York State Department of Health have provided seniors with best practices to follow, particularly older adults like those at the Queens B'nai B'rith House. Is there any additional guidance that you'd like to see issued by the CDC that could provide even more protection for seniors?
Look, hindsight's 2020, but I would have said if you asked me from late February and early March on, we really wished and wanted the CDC, the Department of Health, to give clearer guidance from the beginning. Even in relation to masks, I remember asking them in late February, we had a bipartisan briefing. And, I know that there were so many unknowns, but we couldn't even get clear answers as to, should people wear masks? Are masks helpful? Our healthcare facilities don't have enough PPEs. And even when people are visiting their loved ones in various residences or facilities, try to make sure you are washing your hands and know that what we know now, that even if you are asymptomatic, you might still be infected with the coronavirus. Testing is now much more widely available throughout the city of New York and especially in Queens. And so we ask that people take the proper precautions if you are, especially if you are visiting someone with underlying conditions or someone who is elderly, to get tested before you go, find out the results, and also to properly wear your masks.
Well, congressional offices are invaluable for their district constituents, especially during a pandemic. Could you talk about the work your office has done with older adults in the district to help connect them to the resources and supplies that they need during this incredibly tough time?
Sure, thank you. I would say even though our office staff has been teleworking, working from their homes, our office is not physically open. Our phone lines are busier than ever. We're trying to take calls live as much as we can. If a live person does not pick up, please feel free to leave a message. Someone will get back to you within 24 hours. But I would say a lot of the calls have come stemming from follow up about programs of bills that Congress has passed, for example, the stimulus money, unemployment checks, and some people who might own small businesses, for example. A lot of the calls and inquiries coming in have also been about food insecurity. We have various institutions in our district that are providing food or have food pantry, and as we volunteer and visit some of them, we see the lines are around the block. These are folks I've heard from people who told me that they lost their job or they lost income and they're literally unable to purchase the amount of food to feed themselves and their families that they were before. So these are the bulk of the questions that we've been getting.
Congress passed the CARES Act, the first economic stimulus package, back in late March, and it quickly became law. The House more recently passed the HEROES Act. Both bills provide funding for HUD-assisted senior housing in response to the pandemic. B'nai B'rith appreciates that Congress recognizes the need for more funding for affordable housing. Why was passing the CARES Act critical, and how important is it to pass another federal stimulus bill?
Well, it was very important. People were hurting. Americans were hurting, especially in New York. People were really suffering. People lost their jobs. People lost income. People were not able to pay their rent or their mortgages. And so I'm glad that Congress was able to move quickly and pass CARES. However, the House passed the HEROES Act, and we still need to make sure that the Senate is going to pass the HEROES Act too. That would provide more funding to more New Yorkers to be able to help them survive and to overcome this pandemic. There are still people in our neighborhoods who have been unable to get sufficient amount of help, even with the bills that Congress has passed. So passing the HEROES Act would indeed help a lot more people. We actually just went through this year's appropriations committee process. We've helped allocate or started to allocate funding that would go towards helping studying senior housing and potential homeless elderly as well. So there's a lot more work to be done.
The final question. New York has just held primaries last month. How will New York State change its procedures as we move closer to the general election in November? We're talking really now about the mail-in ballot option for New York State. Of course, something extremely important to seniors, not able to get out, particularly now. What does voting by mail mean for participation, especially for older people?
Definitely. Well, we now see how important and how valued the United States Postal Service truly is. And while we are all very happy that we can vote safely in our homes without traveling to the poll sites, know that New York, as much as I love New York, we are behind a little bit. There are many states around the country who have had vote by mail for decades. And so I hope that this is the beginning of a process that we can see even when we're not in the midst of a pandemic. New York voting rates are pretty low compared to the rest of the country. And we saw in many cases, in most cases, I would say, and I'm thinking about Queens more, the number of people who voted by mail equal or surpass the number of people who actually came out to the poll sites on election day, which means that people are comfortable voting from home. People are comfortable and want to utilize voting by mail. However, in New York, there are still some archaic laws that need to be reformed. We've all heard stories about people not signing the envelope that your ballot went into, which invalidates your ballot. The mail service was slow. There are literally people that we all know that did not even get their ballot until after election day. And that's not acceptable. We need to make sure that everyone can participate early and fairly.
Well, Congresswoman Meng, we really appreciate all you're doing for seniors. In our Jewish community, our community has a very wide proportion of seniors relative to our numbers in this country. Our interest, of course, is in the welfare for all seniors, and that's what we do in our senior advocacy and our housing program. But it is really very important to know that their representative in Congress takes a special interest in these issues, and we deeply appreciate it, and we thank you for taking the time to be with us today.
Thank you so much, Dan. It's great to be with all of you. And thank you for all that you do for our seniors in Queens.
Well, special thanks to Congresswoman Grace Meng for joining me today, and thank you for tuning in to this edition of Conversations with B'nai B'rith. If you found today's program to be of special interest, make sure you never miss a show by subscribing to the B'nai B'rith YouTube channel. And be sure to visit our website, bnaibrith.org, to learn about our work, like us on Facebook, and follow us on Twitter. For my guest, Congresswoman Grace Meng, I'm Dan Mariaschin. See you next time on Conversations with B'nai B'rith International.